We've
no
already,
supervisor coming.
we've already been,
So you are trespassed from
I've
Planet-
already,
you're
I've already
trespassed-
settled
Yeah.
with Planet Fitness. They
Okay.
promised it won't happen again.
Are
I
your
need you to
dogs-
call your
are-
supervisor.
Are your dogs?
I need you to call your
That happened.
supervisor. You are committing a felony. They are committing a felony.
gonna keep talking
I
or
need
you
you to
gonna let me
enforce the law,
myself?
please. Officer 48, no, sir. If you're not willing to enforce the law, I'll sue you in court because treason is the only reason.
Okay,
Lose
you're
your job.
dispersed. See you later. You're trespassed. If you don't leave, you're gonna get arrested.
Okay, no problem.
Okay.
No problem,
Are you
sir.
gonna leave?
If you're not going to enforce the law,
Are
yes,
you gonna
sir.
leave?
So service animals aren't welcome in
That's not, I'm trying to tell you what it is, but you don't want to listen.
what are you saying?
Okay.
I'm listening.
So this Planet Fitness number one does not want you here. Okay. So that's a moot point for here. However,
He said he doesn't want
are
me
you gonna
here
let me
on
talk?
film.
Are
Would you like to
gonna
watch
are
the
you gonna
film?
let me talk?
Would you like to
Are
watch
you
the
gonna let me
film,
talk?
please?
No.
You
wanna let
wouldn't
me
want to
talk?
watch the evidence.
I want to
Okay.
explain to you.
So you just want to hear what he had, his
No,
hearsay, and
I'm going
not
to
see
tell
the
you what
evidence.
their rules are here. about
Service
this.
animals
Right.
aren't
So
welcome here.
Right. So that's
See,
what he
you heard
said.
him. You heard him,
That's what
ladies
he
and
said.
gentlemen.
However, you said you need to have them marked as a service animal. So if you have a vest for the dog, something
Federal
like that,
law states that they
Okay, well,
are
their
not
policy
allowed
is
to
that.
ask that.
that's
They're,
their
okay,
policy.
then their
okay?
policy is
So you
exceeding
take
federal
it up-
law,
So
sir.
you take it up with
I
a
already
lawyer?
have.
Okay.
I already
So
have.
you are not allowed to.
They settled and they said this
You are
wouldn't happen
trespassed
again.
from him,
I'd like you to do
if
your
you do not
job.
leave,
They're
you're going to
they're
get
committing a
arrested.
felony. They could do up to 2 years for
I
this.
am telling
They've
you.
already been corrected. They
Matt.
know better, and they're not supposed to do it, sir.
Number one, do you want to get arrested?
Now
or
I'm
do you
threatening
wanna
to be
leave?
arrested for
Yeah.
standing up for my rights.
No, you're
Oh my
threatening to be
God!
arrested
Please,
for
sir.
trespassing.
Please, sir. Please step back.
Okay, so I've asked you.
I know,
telling
I
you
know,
to leave.
and you're still
Get in
refusing,
the car.
and you're refusing to get your supervisor
Get in the
because
car.
you're refusing to get your supervisor,
Get in the
right?
car.
Right here.
All right, sir. My service animal is being refused entrance.
I have the whole
I already had a lawsuit, and I can show you the film. We've already settled. They promised they wouldn't do this again.
Okay. Unfortunately,
They have no right to tell me that I have to have a vest on my dog. ADA states they have the right to ask if it's a service animal and what services. I have the right to hide my disability because, and the reason in 2017 they revised the law because in Florida there was people that were renting cars and the car had rental identification on it, and because of the rental identification, the people in the area knew that those people weren't from there and were targets. So therefore, in understanding that part of why they revised the law is because to say if you're going to make me wear a giant sign saying I'm disabled, you're causing me to be a target in places where I'm not safe. So that's why this business has no right to ask me to wear any type of identification like they're asking. And if they are asking to wear some sort of a sign, why don't you ask them to print one out so I can just put it on the dog and finish my business because I paid to be here. And like I said, the lawsuit has already been settled.
Sure. So you talked, right? Let me just talk now, okay? All of this has already been explained to Officer Stone, correct? We've already done that.
Officer who?
Officer Stone. This is Officer Stone.
48.
Okay? This has already been explained. He
Right.
asked you to leave. He told you that you're trespassed, okay? If you have issues with Planet Fitness or the way that they
Yes,
do
I
it,
can show you on film that they committed a felony,
you need to
Section
get
2,
over it.
Part B of the ADA.
need to
They
get
could
over
do
it.
up to 2 years
This is a
in
private
jail for this.
business. This is a private business.
He's refusing service, public service
Okay.
to it.
You know what that
access.
means? That means you're about 2 seconds away
Well,
from putting your
I,
hands up.
sir,
So now
sir,
you have to get in your
I'm
car.
just explaining to you why I'm going to see you in court right now.
Okay.
If you
Please,
don't leave-
please, sir.
If you don't
Please,
leave
sir.
now, you're getting arrested.
Please, sir, relax,
Go in your
please.
car.
I don't mind leaving. I was
right,
just
then
trying to
leave.
talk to your
Then leave.
supervisor
It's over,
coordinately
because
about the felony that you guys are
We're too busy to
committing.
deal with you today. So go
Stop,
over
please,
there.
sir.
All right, go in
Please,
your
keep
car.
your distance.
All right, then go in
Please,
your car.
I'm disabled. Stop
All right,
pushing at
then
me.
go in your car and leave. And stop causing problems.
I just want to make sure, officer, your badge number and his also.
95.
Your badge number, please.
21.
21,
95.
95. And you're
Everything's been explained.
so you understand the ADA laws, right? You're supposed to be here to enforce them. All right, no worries. Thank you. You know, I'm not feeling too good. How far do you want me to drive? No, I'm good. My doctor just says I shouldn't drive when I feel this way. How far do you want me to go? Okay, no problem. If something happens, it's your fault, right? You just told me I have to drive. I'm disabled. I'm okay. I just need to calm down. My doctor tells me when I feel this way, I should relax a little bit. share, subscribe. Comment for future content. Pretty sure they're gonna follow out of the parking lot. Back up.
Stay in the car
Okay.
and roll down your windows.
Okay.
I don't
What,
want
what did I do wrong?
I'll fill you in as soon as you
Okay.
comply with what I'm asking.
Okay. I used to go to church here when I was younger.
It's because you have no front plate. Your dashboard is all.
It
Is
fell
there a
off.
lot of water sitting on your dashboard?
It's food grade waste.
Okay. So I need to see your license, your registration,
For what?
and insurance. You have no front plate.
I have it right here. It fell
Okay,
off
it's
this
supposed
morning.
to be displayed, and it wasn't on last night when I dealt with you, and I let it go.
I have it.
Yeah, it has to be displayed on the front back.
I can take care of it right now, sir. I was gonna wait till my mechanic took care
I
of it.
need your license,
I
your
can take care of it right
registration,
now
and
if you'd like,
insurance.
sir.
Nope, I want your
All
license,
right, no
registration,
problem.
and insurance.
Yes, sir.
Thank you.
My insurance. I hope you're staying tuned, guys. It's a really bad day. Sir, my insurance is on direct deposit renewal. I just can't find the new thing. I'm sorry.
Okay.
They sent it
Right.
to me in the thing.
I think Officer Stone's already made up his mind,
If it's
and
not, I'll pay it.
yeah, listen, the statute reads that you have to have it present
All right.
when an officer asks
All
for
right,
it.
guys.
I'm just letting you know.
I can find it. I'm just not. My eyes are bad right now because my blood pressure went up, and I see.
Yeah, that's why we got a rescue call for you.
See that well.
Okay.
That's why I can't find it. I do have it, sir. I know he didn't give me time to look for it. I have it, sir.
Okay. Just let your eyes rest. Get back in the car. Okay. If you can find it, great. If not, the statute reads it has to be able to be presented.
I showed him the contract. Usually, whenever I show the insurance contract, yeah, that's.
So no, I have contracts from like 10 years ago on my phone. They're the other vehicles. So that doesn't work. You have to have effective
That's my
date.
insurance.
All right. Well, again, you have to be able to show a police officer the effective date. That's part of the statute, okay? If you don't show it on demand, you can get ticketed, even if you do have insurance. Okay. All right. I understand that. But usually what happens, you have an email, right? They email it to you. So that way, when you're waiting for that paper copy, heaven forbid you get stopped.
I can't see right now.
Okay. You want to show me? Maybe I can see if it's effective.
I tried to tell him. He said the same thing.
Okay.
I didn't do it on the email.
Okay. Well, I'll tell you what. Just relax. Don't even worry about that anymore. You just chill out until the rest of you. Okay?
Yeah.
Try and stay warm. All right. Hey, Matt, can you walk? Yeah. If you can, let's go meet them over there because I'm sure they're gonna want to take your blood pressure and things like that. Okay? You need a stretcher, or can you get over there? All right.
So this is Matt.
Okay.
I have high blood pressure.
He's got high blood pressure and he's having some vision problems.
I have a mass on my spine. My doctor tells me
You have a mass on your spleen, is that what you said?
spine.
Spine?
Yeah, I have this Texas thing. I don't know. It hurts. It causes me to pee and poop all the time. When I get excited, sometimes I pass out. The coppers chased me around the parking lot. He told me to get in the car and drive away. He pulled me over here. I told him I just need to relax.
Okay.
It's over. I just need to relax, I told him.
Okay.
When I thought he was gonna throw his hands on me again, I said, well, maybe I need a doctor, not a hands-on search again.
Okay, well, I mean, they have procedures that they have to follow.
Yeah, I'm in a
so-
lot of pain. I don't need to be rolled around on the ground. Yeah, sorry, man.
So, what is bothering you right now?
He's telling me that he needs me to see right now, and when this happens, my vision gets blurry and I shouldn't be driving. They're telling me to drive, and they're also telling me to freaking look in my thing, and I can't. I'm telling him I can't see right now. I shouldn't be driving. I shouldn't be doing any of that. And then when I'm explaining to him to calm down, he's starting to act like he's going to be hands-on. I said, I started getting overwhelmed more, and I knew at that point, if he keeps going, I'm going to pass out.
So,
It was the common denominator, knowing,
common denominator is what?
knowing you'd stop. He would stop. He wouldn't put his hands on me when I need medical attention. I apologize. All right?
What medical attention do you need, though?
Look, I was going to pass out. I'm sorry.
You felt like you were going to pass
I
out?
was going to pass out. I'm sorry, man.
How do you feel?
All right, I'm overwhelmed. My vision's blurry. I'm still having trouble seeing right. He's trying to get me to drive and shit. I'm not sure. That's making me panic, all right?
Okay, well, I mean, obviously we're trying to find out what's going on. So, and what's going on with you, why we're here and how you're feeling. Do you need to go to the hospital?
I think I'm all right. I thought of the guy trying to rip me out of the car and I started to panic, all right? I'm sorry.
Okay. Are you having pain anywhere? Are you?
It always hurts. And I always feel like I got a piece of shit, man. I'm fucked. After the operation, I'm not going to walk. Stop.
So, what's your name? First name.
Matthew.
Matthew. Okay, Matthew. Matthew, do you know what year it is?
Yeah, 26.
Okay. Who's the president of the United States?
Trump.
And what is your date of birth?
3179. I just, when I get overwhelmed, I panic, I pass out.
Okay.
When I felt like I was gonna pass out, I panicked.
Do you
And
mind
he
if
asked
we,
for a medic. I said yes because I knew that would stop him from doing what he was doing. Sorry,
do you
man.
mind if we check you real quick, check your vitals and stuff?
It's okay, yeah.
Do you want to come to us? You want to get in the truck quick?
I'd rather sit here.
You want to sit here?
Please.
Matt, what's your medical history look like?
Hey, bad. They told me I wasn't gonna live till I was 23. I'm still here.
I'm sorry to hear that. Why would they say that? What's
They
going
said it was MS.
on? Okay. Are you on any medication because of it?
I wouldn't have been. I would have died a long time ago if I was on the drugs that I was
Now, are you officially diagnosed with MS?
That's what they said. I was the youngest case. They don't know how to officially diagnose it except for the symptoms at hand, and then just say they're not diagnosing it. They're just naming the symptoms.
Okay, so
There is no real.
would it be official to say that you're diagnosed with MS? Or if we were in the hospital and they looked at your medical records all the way back to when you were born, would they say that you have a diagnosis of MS? Or are they just speculating?
They told me at that time they wanted to send me to hospice, and my mom told me I could go to hospice for leave, and I didn't know hospice was prepared to die. I thought it was like a newborn or something.
Okay.
I just left.
All right. So, and you take no medications daily right now?
No.
No
They
medication.
try to get me on opiates from it.
Is that because of the pain? Why they wanted to prescribe you opioids? Why would they prescribe you a pain medication?
I have a 2 to 2.5 inch mass growing on my spine where my aorta splits my legs.
Okay. And that caused you pain?
Constantly pain, it makes it feel like I always gotta use the bathroom.
We got 95 on heart rate, 96 on SpO2, pressure currently.
And that's on your spine, that mass is on your spine? You know where on your spine it's located? Is it on
The inside, where
your lumbar spine or?
it's exactly where the nerve, the things that make your legs move, where
Yeah.
it splits and goes down to your legs. That's where it is. They have to sever it. There's no, unless they take it, take it.
And so, like I said, you're not taking any medications. Do you have any allergies to medications?
Nothing, I know.
No known allergies to your any medications. Any drugs or alcohol today?
No.
And do you know what year it is?
2026, lost that already.
I'm sorry, I'm a different provider. I'm a paramedic. The lieutenant was asking you the first time. I wasn't here right away.
Yeah, it's 2020.
Do you know who the president is?
Yeah, Trump.
And again, silly question. I know you're in pain right now, but do you want to go to the hospital?
No, which is,
Okay. And the only reason why I ask that is because what I'm going to have you sign is right to refusal in our care, stating that we understand you're in pain and we have no problem taking you to the hospital. We actually wish that you could go to the hospital to get definitive care for your.
nothing you guys can do. Relax.
Well, you're symptomatic to this growth on your spine near your aorta, so
Yeah.
obviously it's causing you some discomfort.
And the answer is either never walk or feel my nipples and legs or deal with pain.
I mean, again, there are options. You can speak to different doctors, get different opinions. You don't know. You may get a different doctor today. He may give you a different perspective on the situation or refer you to someone that he knows would work better. So,
I went to some of the best in the country.
okay.
Very well. Number one for the actual job they need to do. They were pretty much, telling me that probably really as long as you can, because they're not walking again.
Okay. We're gonna take your blood pressure one more time, okay? It was pretty high. Do you typically have high blood pressure?
No, this guy just gave me some bad news. They've been talking about bringing fucking my whole day up.
Now, Matt, I have your information here as 75 Sewin Street, apartment B110. Is that still accurate? Okay. And like I said, what I'm going to do here is I'm going to have you sign a refusal stating that you don't want our care,
Finger real quick.
although we're
What do you mean?
pleased
taking your blood
you
sugar.
that
You got a fifteen.
you need to. I would highly urge you to go to the hospital.
The blood pressure alone is dangerously high.
I'm sorry?
What are they gonna do?
Well, we have cause for concern because you have very high blood pressure right now, which could be causing you the blurred vision.
Well, they just told me that freaking.
I'm sorry?
They just told me my insurance is fucking. I need to pay it again.
116 on the sugar.
I forgot to pay my insurance, man.
Well, if that's the only reason stopping you from going to the hospital, I would say deal with the bills after.
No. There's nothing you guys can do for me in the hospital.
Well, they have medications that can get your blood pressure downwards in a safe range. Yes, they do. So maybe not cure you totally of all your ailments, but they'll be able to treat some of what's going on today and get you feeling better. So that's why we're concerned that when your blood pressure is high, your risk of a stroke, your risk of different things, it stays high. So that's why we're urging you to go and get it checked and get treatment, because we don't want to see something happen.
The guy with a gun was chasing you around the parking lot.
Irrelevant of why
your
it's
car,
high.
you would have high blood pressure
You're right, I
too.
probably would, but not that high. Yours is high for probably different reasons. And no matter what caused the high blood pressure, it's still high and should be looked at by a doctor, is what we're telling you.
I know my limit. I just need to relax, right?
All right. So I just wanted to go down on record, and we have witnesses here stating that we are urging you to go to the hospital because we believe that there's a serious medical concern right now, and not only just the concern for you and your person. However, if you were to operate this motor vehicle and a medical emergency were to occur, then you could injure somebody else as well. You understand that, right? I'm sorry?
No, I can deal with it for a long time.
Okay, all right. Well, this is the first time talking to you, and I'm just giving you a very clear perspective where we're coming from, okay?
Go to the hospital. Is this a life and death type thing? That for the protective custody?
So my only concern really generally in the situation is that he's stating that, he has blurred vision and he's hypertensive, so...
I was being chased around by a guy with a gun trying to arrest me.
Who is that?
You.
A guy with a gun? I'm a police officer. My gun never left.
And you threatened me to arrest me because I was trying to have a conversation
Listen,
with
we're not going to go back to that. That will all be documented with the trespass law. Okay? We're here about your medical right now. That's my concern. Okay? So, this is the deal. Rescue is saying you should go to the hospital. They're telling me that you cannot, they pretty much believe that it's not safe for you to operate a motor vehicle.
Right, I need to
Based on
relax,
your medical,
right? I just
your high blood pressure and you can't see because you stated yourself that you're not blurry. So I'm not gonna allow you to operate the vehicle from here.
All right, good.
So
I don't
this
want
is the
to.
deal. So
I was
you're gonna-
telling you I needed at least a half hour before you made me leave that parking
Right,
lot.
but I'm not a doctor. And I
I
actually
know.
let you
I told
stay
you my
there.
doctor recommended I needed
I
to.
let you stay
2
there.
minutes, you said.
Yeah, but you left before the 2 minutes were up. So this is the deal, okay? If he tells me that he doesn't feel comfortable and the fact that you're refusing to go to the hospital and this is life-threatening, I'm going to let him finish explaining to me. I'm going to place you into protective custody and force you to go to the
My
hospital.
service animals need to come with me if I go to the hospital.
Now, we can't take a service animal in rescue. It's only designed for one patient. sir.
I've been to the hospital with my service animals before.
Your dogs, sir, your dogs can go. We have a secure facility. Animal control. Sorry, animal control is here for you. They're the best in the.
My
They're the best in
service
the
animals,
state.
federal law, and this is the
I
reason
don't
they were
enforce
chasing me
federal law.
around the parking lot.
I thought it
Federal
was
law
around the
says
law.
my service animals are supposed to stay by my side no matter what. I've been in rescue before with my service animals. They're on the
We can't fit your dogs in the rescue. We cannot fit them in the rescue.
I don't know what the federal law says about the service animals, but what I do know as a licensed paramedic in the state is that rescue vehicle is only designed for one patient and one patient only.
I have the proper.
And we don't have the proper restraints to secure the dog to the rescue though. But let's just in practicality, right? So we have seatbelts in the rescue. But hear me out, all right? So we have seatbelts in the rescue, not only for us, but for you. That's why we have the stretcher. There's right, but let's just say, hypothetically speaking, we're doing 50, 60 miles an hour on the highway to the hospital, right? And they're not secured in the motor vehicle in the rescue, and there is an accident. What happens to those dogs? Are they restrained? Do we have the proper restraints to make sure that they're safe in the vehicle, or
They're just as good as in any
not?
other
Not when they're
vehicle.
standing next to you. Absolutely not.
If they're sitting beside me, just like they're
No,
sitting
that's
in the
not.
vehicle,
It's not
that's-
accurate at all. I'm fearful that they would get injured. And for your dogs, this is out of concern for your animals. I'm not trying to give you a hard time. I'm just trying to advise you that that can't happen, because if there was an emergency, such as a motor vehicle accident, they would get injured, severely injured, or even pass if we got into an accident at that rate of speed.
Sorry,
You just that's why we do it. That's why the Department of Transportation makes us do that.
That truck is governed by the Rhode Island Department of Health. For patients only. I'm the lieutenant on the truck, I'm in charge. The dogs are not going in that truck.
my service animals.
I don't care. You can get your service animals back when you get done, or you can make arrangements to have them transported to the hospital. But we cannot transport them in our rescue. That's
My
it.
service animals are supposed to leave
No,
inside.
they're not riding in my.
All right, so
I don't.
do you believe that he is a threat to himself right now?
However, my own.
Say medically. Say medically. Is he medically?
Medically, his blood pressure is high enough, especially having a symptom alongside of it as blurred vision, which is indicate that his blood pressure is high enough.
I'm legally blind to my left side, so when you say the symptoms of blurred vision, I'm legally blind to my left side.
Yeah.
We're only going by what you told us.
Alright, I
You told us you
apologize.
could not see.
I'm legally blind to my left side.
So is it normal for you to have blurry vision
When
on
my
your right
vision-
side? Because you said that your vision was blurry when we arrived.
When I get overwhelmed and I feel like I'm gonna pass out, usually that's the first symptom.
How is your vision right now?
It's better, and I can see fine, but it's hard, even when I'm feeling fine, for me to focus and see like leaves
that
and
normal?
stuff like that. That's normal. It is normal.
If you tell me that he is not capable of taking care of himself and making decisions for himself in regards to his health, I would place him in protective custody based on your
Me not driving is what my doctor tells me I should do, and I've always been fine. I've been doing this for a long time.
What's up with the
Well, it's
Matt, can I ask you a question? What is stopping you from going to the hospital? What, honestly, what's your reason? Is it just the dog?
The operation that they're gonna do to me.
No one's gonna operate on you. They're
Then
gonna.
there's no reason for me to go to the hospital then.
You think the only reason to go to the hospital is to get an operation? What if you have a medical issue like you do, high blood pressure,
Yeah,
blurred
I have high
vision?
blood
You know
pressure.
those are symptoms of more serious things? So, again, my question is, what is it that's stopping you from going to the hospital? Is it just the dog?
No.
What is it?
I've been, the only thing they want me to do is either go on opiates or get ready for this operation,
Okay?
and either one means like fucking
Okay.
not functioning way more than I'm not functioning now.
So can I ask you a question? You have an operation scheduled? Do you have an operation
They
scheduled?
wanted to, yes. And
Okay.
out of Brigham.
So
but,
what if you don't make it
the
to that
insurance-
operation because you don't take care of health issues today?
It's just way longer. The pain
No, I'm saying,
doesn't
what if you
stop.
have an issue today that gets you hurt really bad, and now you can't have an operation? You get what I'm saying?
And I don't walk anyway. What are they gonna do to me?
Matthew, we're gonna take your blood pressure again and see if it's changed now that things are kind of, some time has gone by. We'll see where we're at, and then, depending on what we see, we'll make a determination, okay, bud? We're not trying to give you a hard time, but the problem is you've obviously got some health concerns going on, and you've obviously got some stuff going on right now where you're hypertensive, and we're just concerned that if we drive away, right now you have blurred vision. You could drive away and all of a sudden you could lose feeling on one side of your body because you're having a stroke. You could, don't sit there and laugh. I've been doing this for 25 years.
No, I've worked with
I
people with
literally
strokes.
watched a guy stroke on my stretcher
No,
2 days
I
ago.
just watched it.
So don't say that it can't happen, okay? It's very common when your blood pressure is that high for you to have medical issues that, kind of go along with it, like a stroke or a CIA or some sort of...
You ever notice the ones that don't panic, they don't get out of here that easy,
Well, the thing of it is we just don't want to see something happen down the road, like later on. I know you don't want to go to the hospital. I know it's a bother. I know nobody does. Trust me, nobody does.
You gotta make my blood pressure worse while you're trying to think it.
Well, I'm just trying to talk to you. I'm not trying to make it worse. I'm calm. I'm not running at you. I'm not just trying to tell you it's just a concern that you should be concerned. That's all.
I can feel it getting worse. Making me laugh and shit. Come on, man.
I'm not trying to make you laugh. I'm trying to warn you that you could be making a decision that could hurt you.
I've been making that decision since I was 17, man. That didn't count. You're making me laugh, man. Do it again.
All right, we'll do it again.
Do this cup again, so they get all bubbling like that.
Come on. I got pickle juice right there. I'm good.
What's that?
I got pickle juice right there. I'm good.
Pickle juice?
Yeah.
I didn't hear you. What did you say?
I have pickle juice right there. I'm good.
What is pickle juice sound good?
It's my what do you call it? Blood pressure really got out of hand. If you're diabetic, you can take pickle juice for that pain.
Really? I've never heard that. I've never heard that pickle juice causes cure for hypertension.
I thought it was the leading cause.
Pickles are very salty. Usually
Yeah, the
pickle juice.
the brine is usually very salty. It causes hypertension.
right.
If you have
The
it-
sodium typically causes hypertension because the way the intravascular fluid stays in your body.
and your kidneys have a tough time
So
filtering it out.
your blood pressure is so high, it's 179 over 128, even though you're taking it several
Yeah,
times.
that guy was telling me I gotta fix my insurance before I leave the contract. The guy's telling me I gotta fix my insurance before I leave the contract. Yeah.
Well, the thing of it is your blood pressure will go up and down depending on stress levels, but that amount is usually more than just stress. You know, you obviously have hypertension. There's no doubt about it. You said you have blood pressure issues. Huh?
The guy's somebody chasing me around the parking lot. And I said,
Okay, well, that was like 20 minutes ago. You being chased should be, you should be, you know, coming down right now, not going up.
All right, Matt. So what I'm gonna do is I'm gonna have you sign our iPad here. Okay. This big white box. What this is essentially, you're signing is that you are refusing our care, any further care from us, and you're refusing transport to the hospital. Although we urged you multiple times of your health concerns and what it could lead to, that you're still denying against medical advice to go to the hospital. So when you sign this,
are you guys gonna do it anyway when I sign this?
no, if I sign this,
Are
then
you
I
guys
would,
taking me to the hospital anyway?
No.
no.
No, you
Nope.
sign that, I'm gonna leave.
Yep. We are concerned for you. We don't want to force you to go to the hospital by putting you in protective custody. I don't think you're at that point. Us as medical professionals are urging you to go to the hospital because we have a huge concern for your health. I don't want to force you. I really don't. I want you to voluntarily go to the hospital because you are taking our advice that we know that there's a serious health concern. I don't want to force you, Matt. I really don't. And I'm trying to be real with you. I
I'll be
want you to
honest.
be healthy.
If I'm gonna be treated properly with my service animals, I have to go to Boston. And then to say, even to understand that, on top of that, the proper doctors for the problem that I have, Brigham Hospital has the #1 in the country right now.
So the way that would work is that we would transfer you to the local hospital here, and then because we wouldn't transport out of Rhode Island. The rescue's
Yeah,
not
but you guys,
registered for that.
you guys
We
are
would-
saying you would send my dogs to a kill shelter
Absolutely not.
if they take me right now.
Absolutely not. No. So they have a very, very nice facility here in town.
Yeah, it's called a kill shelter.
No, it's not a kill shelter. It's an animal shelter. Yeah.
My
Don't,
service
listen,
animals.
I have,
My
we
service
all have
animals.
dogs.
I'm supposed to
I have
leave
a,
my side.
listen, Matt, can you listen to me?
Yeah, but you're violating
Matt, could you
federal
listen-
law, like you
Matt,
did over there in that
Is this over
parking lot.
federal law or is this over your care for your dog? In your health. Let's pick a topic, okay? Matt, I would never in a zillion years let something bad happen to your dog.
Right.
Me personally, okay? Never mind our
Well, you
animal
just
control.
denied them public access.
No, this is, I'm not talking about that anymore.
You're just-
Matt,
you're just
I'm not
violating
talking about that
federal law.
anymore. I'm not talking about that anymore. That's
You
topic.
did it last night,
That
too.
topic's done. It's over.
did it last
okay?
night,
It's
too.
over. You're
You
showing me
legally
that
said that I'm not allowed in those public places because I didn't have service
this
animal
is your
papers.
ticket. Display
And
a
I'm not
plate
allowed to
and
go
your evidence
back.
of insurance. You have a court date, April 21st at 10. Rhode Island Traffic Tribunal. You're gonna sign this thing, or are you refusing to sign?
What?
The refusal to sign. Are you refusing?
No.
Okay. Sign it, and we're out of here.
Use the skin of your finger.
Are you lefty or righty?
After the accident, I learned to right with my left. My right hand didn't work anymore.
All right. All right, Matthew. If there's anything else that changes, if you feel any different and you need us, just you know how to get a hold of us, right?
Yeah.
All right. All right.
Why don't you drive yourself to Brigham?
See, I forget.
Yep, I'll see you in litigation. You're all set. Huh? You're all set. Yep, absolutely. Good luck to you, Matt. Quick fix, just put service animal on the dog, you may not have this problem. Quick fix, common sense, all right?
Oh, yeah. Violate federal law.
Have a good day.
Just because you don't like the law doesn't mean you don't enforce it. It means you change it. Yes.